Do you have trouble breathing through your nose? Chronic nasal congestion is a very common condition that patient will experience. Nasal congestion that it could be caused by allergy, sinus infections, upper respiratory infections, but also that it could be caused by a structure obstruction in your nasal passage. So if you're already taking allergy medication, if you're already being treated for sinus infection, you might need to be evaluated for any nasal airway obstruction caused by structure obstructions. So the most common cause of structure obstruction will be a deviated septum, enlarged inferior turbinate. Also that sometimes polyps will cause nasal obstructions. A deviated septum is caused by the wall that in between your nostril that is cracked, and that will cause some narrowing of the nasal air passage. Turbinates are the tissues that in the side of our nose, and they can get swollen and also causing obstruction of air passage. If you already taking allergy medication and you have tried non-surgical treatment for your nasal congestion and nasal obstruction, then you may benefit from some surgical treatment to improve your nasal breathing. The most common surgery is one is septoplasty, and the other one will be a turbinate reduction surgery. For septoplasty surgery, it is performed under general anesthesia, and patient usually will go home on the same day. You will experience some congestion and pain for approximately a week or so, but once you're healed, you will notice that your nasal breathing improves significantly. For turbinate reduction surgery, that is for us to either shrink the turbinate or partially remove up the turbinate tissue. That can also significantly improve your nasal breathing after the surgery. Now, there are also patients that their nasal obstruction is due to collapsing of the nasal valve, which is close to the nostril area. For those patients, they may benefit from an in-office procedure called a Vivere, and that helps to strengthen the cartilage in the nasal valve area, and that will also relieve their nasal congestion. So if you have been suffering from chronic nasal congestion and you have already tried the typical medication treatment, and you can see a ear, nose, and throat doctor and see if any of those surgical treatment is the right option for you.